Manual muscle test of the plantar flexors. What are the plantar flexors? The plantar flexors consist of three different muscles: the gastrocnemius, which flexes the knee and plantar flexes the foot; the origin is the posterior femoral condyles; insertion is the calcaneus via the calcaneal tendon; and the nerve is a tibial nerve. The second is the soleus, which plantar flexes the foot. Its origin is the soleoline proximal posterior aspect of tibia and posterior head of the fibula. Its insertion is the calcaneus via the calcaneal tendon, and it is innervated by the tibial nerve. The tibialis posterior is the third and final muscle that makes up the plantar flexors, and it plantar flexes and inverts the foot. Its origin is the proximal posterior shaft of the tibia and fibula and the interosseous membrane. The insertion are all five tarsal bones and the bases of the second through fourth metatarsal, and it is innervated as well by the tibial nerve.
In order to show the manual muscle test of the plantar flexors, we first have the patient plantar flex against gravity. This shows at least a grade 3. Then we would have them perform the same plantar flexion motion against resistance. First with moderate resistance, that would be a grade 4, and then max resistance, grade 5. In order to put the gas strap on slack, we have the patient flex their knee, and again, perform plantar flexion against gravity. In order to show the manual muscle test of the plantar flexors, we first have the patient plantar flex against gravity. This shows at least a grade 3. Then we would have them perform the same plantar flexion motion against resistance. First with moderate resistance, that would be a grade 4, and then max resistance, grade 5. In order to put the gas strap on slack, we have the patient flex their knee, and again, perform plantar flexion against gravity.
Clinical presentation and functional limitations of plantar flexor weakness. Some things that might be present in the clinic that you would see would be plantar flexor gait. There's a shorter step length on the involved side or bilaterally, decreased or absent propulsion, which will then affect terminal stance. Calcaneal gait, there will be no toe off and could result in excessive dorsiflexion due to weakness of the plantar flexors. Drop foot may be present. Steppage gait may be present. Functional limitations that a patient who has plantar flexor weakness might present with: inability to push down on gas, brake, or clutch while driving; inability to go onto your toes, like when you're trying to reach something above you; walking and running difficulties, difficulty putting on shoes, and issues with going upstairs are just some of the things that patients may have some issues with a plantar flexor weakness. And here are our references. Thanks for watching.